Hello, welcome to the Twin Falls Upper Cervical Clinic. My name is Dr. Troy Jaques. I am a specific upper cervical chiropractor. That is what my degree is. But here's the deal. Even though we're a chiropractic office, this is not your typical chiropractic office. We don't chase the symptoms around. Every nerve in the entire body, it travels up through the area called the brainstem, right up here. And if we take a look at the example of Christopher Reeves, he was the actor who played Superman. He broke the top bone in his neck right there. One by one, all of his organs, they shut down, and he was paralyzed, and he passed away. If pressure on the brainstem makes everything worse, what's going to happen once we take that pressure off your brainstem? It's going to get better, okay? I'm going to start with asking a few questions to find out exactly what your specific problem is. From there, we're going to go into the exam room, and the exam consists of finding some pain and or tenderness up in the top part of the neck right there. When that bone comes out of place, you will not be able to turn your head as far one way as you can the other way. It's going to create restriction in the motion. The next thing that it does is it's going to change your entire posture. When that top bone comes out of place, one shoulder will come up high and one leg will be shorter than the other one here. The last thing that we're going to do in that procedure is I have a heat scanner that runs up the back of the neck, measuring and looking for an abnormal heat pattern. If all that comes to full circle here, that tells us that this bone is out of place and that's what needs to be fixed. Once we fix that, then you're going to start to get better here. We do take specific x-rays of the neck right there to see exactly how that bone has misaligned itself here. And so no matter what the problem is here, we need to determine how that bone is misaligned to get you better here. From there, we send you home, and we're going to take that evening to look at those x-rays so I know exactly what's going on with you. I'll bring you back on the next visit here. I will sit down with you. I'll show you exactly where the problem is and what needs to be done for you to get you better. When I sit down and I go over the x-rays with you here, I'll show you what the problem is, and at that point in time, we will go ahead and start correcting the problem. Now, this is how the whole process works. We make one very specific correction to this top bone right there, and the goal from here on out is to keep that bone in position here. So think of it this way here, and here's really where the fork of the road splits and we're going to go our separate ways. Picture this: if you break your arm and you go to the medical doctor, they'll take an x-ray, they'll set the bone, they'll put that arm in a cast until it'll take 6, maybe 8 weeks to heal. When you go back for that follow-up visit in a week or two, if that bone is healing the right way, what do they do to you? Nothing. If it's healing the right way, they let it heal and they let it keep on getting better. Could you imagine if they said, hey, it's doing really good, let's go ahead and move it some more? It's not going to heal up. Now, likewise, your problems don't go away within one adjustment here. Yes, it would be wonderful, but that's not how things work. It takes time to heal, just like a broken arm does. And so when you come into my office, and from there on out, you will not get adjusted on every single visit here. If I'm doing my job correctly here, you don't get adjusted on every visit here. And it's the time in between you needing to be adjusted is when the healing takes place. So if I have to adjust you every single time you come in here, you're not going to get better. So when you come in and you do not need to be adjusted on a particular day here, the reason we have an MLS laser therapy, which is a class 4 laser that goes deep into the tissue, about 3 inches deep into the tissue, to stimulate the cells to heal faster and reduces the pain and inflammation in a particular area. That is what we do to actually treat the said symptom, because we want to get you out of pain as quick as we can. But if we don't address the root cause of it, it's just going to keep coming back and be a problem the rest of your life here. We deal with this and the individual area as well to deal with your specific needs to get you as healthy as we possibly can here. Lastly, we see the toughest of the tough cases in here. If you're ready to get started here and you're ready to get better here, I'll be in just a moment here. We'll get started with you here.